Sennosides and Ex-Lax Maximum Strength are used to treat constipation and to clean out the intestines before a bowel examination or surgery. They are known as stimulant laxatives and work by keeping water in the intestines, which causes movement of the intestines. It is important to follow the recommended daily dosage and take it at the optimal timing for best results. When taking Ex-Lax Maximum Strength, always follow the directions on the product package or as directed by your doctor. If using the chewable tablets, be sure to chew them well before swallowing. If using the dissolving strips, allow the strip to dissolve on the tongue and then swallow, with or without water. When using the liquid form, be sure to measure the dose carefully using a special measuring device. Do not use a household spoon. The dosage of Ex-Lax Maximum Strength is based on your age, medical condition, and how you respond to treatment. It's important not to increase your dose or take this medication more often than directed. Do not take this medication for more than 7 days unless directed by your doctor, as serious side effects may occur with overuse. It may take 6 to 12 hours before Ex-Lax Maximum Strength causes a bowel movement. If your condition lasts or gets worse, or if bleeding from the rectum occurs, be sure to consult your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience stomach/abdominal pain, cramping, nausea, diarrhea, or weakness, you should notify your doctor or pharmacist. This medication may cause your urine to turn reddish-brown, but this is harmless and will go away when you stop taking the medication. If your doctor has prescribed this medication for you, it is because they believe the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience nausea, vomiting, diarrhea, muscle cramps, weakness, irregular heartbeat, dizziness, decreased urination, or changes in mental/mood. Although rare, a serious allergic reaction is possible. Seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice anything else that concerns you, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Ex-Lax Maximum Strength, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. Make sure to also discuss your medical history, especially if you have had appendicitis, symptoms of appendicitis, a sudden change in bowel habits lasting longer than 2 weeks, bleeding from the rectum, or intestinal blockage. If you are diabetic or need to limit/avoid sugar in your diet, be cautious when using the chewable tablets or dissolving strips, as they may contain sugar. It's always best to consult your doctor or pharmacist before using this product if you have any concerns about its effects on your health condition. For pregnant women, it's not recommended to use this medication for long periods during pregnancy, and it's important to consult your doctor for more details. While this medication does pass into breast milk, it is unlikely to harm a nursing infant, but it's still best to consult your doctor before breastfeeding while using this product. When taking Ex-Lax Maximum Strength, it's important to be aware of potential interactions with other medications. These interactions can affect how your medications work and may increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and to share this information with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If someone has taken too much Ex-Lax Maximum Strength and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of an overdose may include uncontrollable nausea, vomiting, or diarrhea, as well as severe stomach pain. It's important to keep all your medical and lab appointments when taking Ex-Lax Maximum Strength. In addition to taking this medication, it's also helpful to make some lifestyle changes that can help prevent or relieve constipation. These changes include exercising, drinking enough water, and eating a proper diet with fiber-rich foods such as bran, fresh fruits, and vegetables. If you're not sure where to start, be sure to talk to your doctor or pharmacist about lifestyle changes that might benefit you. When taking Ex-Lax Maximum Strength, it's important to follow the recommended dosage as directed by your healthcare provider. Typically, adults and children 12 years and over can take 1 to 2 tablets once a day, preferably at bedtime. It's important to drink plenty of fluids while taking this medication to help with bowel movements. Remember to always follow the instructions on the label and talk to your healthcare provider if you have any questions about the best time to take Ex-Lax Maximum Strength. If your doctor has prescribed Ex-Lax Maximum Strength for you to take on a regular schedule and you happen to miss a dose, take it as soon as you remember. If it's close to the time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When storing Ex-Lax Maximum Strength, make sure to check the product package for specific instructions. Keep all medications out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless instructed. Properly discard the product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.